very quickly, because you're literally stripping electrons off of the gas. There is no radiation present. Okay, remember that there's a certain binding energy holding that electron in orbit. And when you exceed the force with your electrodes, then you're creating sparks. Okay, which of the following is the student for determining occupational exposure to the nuclear medicine technologist over a 1 month period? The photographic film badge, you probably won't see that as a test question choice anymore. It will be an optically stimulated OSL, luminescent dosimeter, something like that, OSL. But however, you might still see film badges. I can't hear. I think Loma Linda's still. No, they were. I think last year they were still using film badges. But remember that. Okay, so an OSL here. The TLDs are not routinely used as whole body monitoring anymore. They're mainly used for your finger ring. Okay. Pocket dosimeter. Okay. How come I can't use a pocket dosimeter?
So it's not very accurate for measuring our temps.
Well, you know, it's actually very sensitive, but the problem is that because you're using a quartz fiber that's been electrically charged, that charge dissipates over time. So this thing wouldn't last a month. This is good for like maybe 1 day. Let's say you have a nurse that's going to be going into a patient's room after they've been treated, you would give them a pocket dosimeter. Now the other thing up here. Okay, according to the NRC, which of the following radiopharmaceutical administration errors must be reported? Did I give you guys, I sent you guys a thing for misadministration, what the current guidelines are? Okay. So you might want to take a look at that. Okay? Because, normally you're allowed plus or minus 10%, but it's actually if you give more than 20%.
That's misdosed.
What's that?
The more than 20% is misdosage, right?
Yeah. So like over here, your patient receives 18 millicuries when they should have gotten 20, when 20 to 25 was prescribed. Okay, that's not an issue, that's just a few percentage points. And, again, you need to know this, you need to know what those values are. The one that I sent you is the most current recommendation. Okay, you got 20 millicuries of I-131 instead of the prescribed dose of 15. Is that more than 20%? Okay. Which of the following agencies must be notified? Okay, basically that is a misadministration, isn't it? Okay. So that's why the NRC needs to be notified. And there's a couple of things that have changed about the misadministration policies. The NRC now is notified when the person gets more than a 1-year occupational dose. Okay? So in other words, if you do the calculations and, first of all, let's go back. A misadministration would have to be reported, but not necessarily to the NRC. Okay? You all remember that from the first chapter, right? Well, it doesn't even have to be reported to the state. If you calculate, let's say that I gave 25 millicuries and I should have only given 15. Okay? That is a misadministration technically, but I don't have to call the NRC because if I did the calculation, the radiation dose to any organ would not exceed 50 rem. Okay? Because remember, that's what you are allowed as an occupational dose. But if I calculated that the whole body dose was more than 5 rem, then I would have to report it. If I calculated that an organ got more than 50 rem, I would have to report it. Okay? Or the lens of the eye got more than 15 rem. Okay? So that's one of the things that have to be kept to keep in mind. And how would you calculate that the person received 50 rem to an organ?
The deep?
Huh?
Effective dose equivalent.
It's the effective dose
Tissue
equivalent.
factor, quality factor, what kind of radiation.
On your package inserts, it tells you what the radiation dose per microcurie is. Okay? One of the handouts I'm going to be sending you is dosimetry. But basically, you put down the amount of radionuclide that you administered in microcuries. So it's going to be the dose converted to microcuries times the percent uptake of the organ. Okay. Times the average life. Remember the average life? What's the average life? No. Okay, then times the effective life. And then we would divide that by the mass of the organ.
Is it 1.44 or 1.9?
1.44. Oh, actually, does anyone remember how you calculate that? Oh, I'm sorry. And then the other thing over here, we multiply that times what we call the dose equilibrium constant. Okay. And basically that's where you look at all of the radiations that are emitted or emitted by that radiopharmaceutical, and you calculate whether they are a penetrating radiation or a non-penetrating radiation. That's a little bit more complicated here, but basically, remember the output data that we discussed way back in the first semester? Yeah, you had gamma 1, gamma 2, gamma 3 for technetium, and they had different energies, and basically any particle radiation is considered a non-penetrating radiation, so all of its energy is absorbed in the organ that it localizes in. And if it's a gamma ray or X-ray less than 13 keV, that's also considered a non-penetrating radiation. The reason why is because, let's say you're talking about the liver spleen. Let's say you're using sulfur colloid, because that's one that they always like to use. And if you injected 5 millicuries, you would convert the 5 millicuries into microcuries. Okay, remember we said that about 85% goes here, and about 10% goes here, and then the other 5% goes into the bone marrow. Okay. You remember what we call the organs that the radiopharmaceutical goes to? No, not target. The target organ is the one that you're calculating the dose for. So target. Now the target organ could be anything. It could be the ovaries, it could be the brain, it could be the lens of the eye, it could be the lungs, okay, it could be the liver itself. And if you were using the liver as your target organ, then you would have to take into account the radiation the penetrating radiations that would be emitted by the spleen and the bone marrow. Okay, they're called source organs. So wherever the radiopharmaceutical localizes is your source organ. And by the time you get through calculating all this, you'll see that like a sulfur colloid scan with 5 millicuries, the liver actually gets about 1.3 rads. So that's not really that much, but it's a lot compared to like an X-ray. Okay, we're at 132. Okay, patient receives a dose of strontium-89 intended for another patient. Which of the following is true? Yeah, that's a pretty bad one, isn't it? Because once you inject that stuff, there's not a whole lot you can do. There are chelating agents that they administer that you can, hopefully, to try to get the stuff out of there before it localizes in the bone. But usually it's going to be too late. Okay. So that's not a very... What do we use strontium-89 for in the first place?
For bone palliation?
Yeah, bone palliation. Okay. Next one. Okay, according to the NRC, written directive is required for the administration of all the following radiopharmaceuticals except. Okay, so technesium doesn't require a written directive. I mean, that's like a special order. That's like a prescription. And when they say written directive, it means that you also have special policies that you have to follow in addition to having just the prescription. So why would that be considered? What's different about all of these guys?
It's not a beta.
That's not a beta emitter, but all of these are used for therapy, right? The 25 millicuries of I-131, you'd either be using that for hyperthyroidism, treatment of multinodular goiter. You may use it for ablation. Yeah, Graves' disease. Yeah, usually Graves' disease, that's a pretty high dose for Graves. Yeah, usually it's about
15,
I've seen it as low as like anywhere
5.
from 4 to 10 millicuries.
Depends on the uptake, right?
Yeah.
15.
Because sometimes you can have somebody that has a really, really high uptake, like 85, 95%. You don't need to give as high a dose. But then you have some people, whenever you have a patient, let's say that they have like 40% and 40%. Okay, whenever you have the 4-hour and the 24-hour are about the same, it usually means that they have what they call high turnover. Yeah, so it's constantly going in and going out. And one of the things that we're warning people about contrast media, when you guys do a CT scan or anything like that, about 4 weeks later, these patients can develop hyperthyroidism for some reason. So that's something. Okay, but then the P32, what do we use that for?
Palliative bone therapy.
Okay, it can be used for palliative bone therapy. Normally, though, we use it to kill bone marrow for polycythemia. Okay, but remember, there's 2 types of polycythemia. One is primary and one is secondary. We haven't talked about hematology yet, but I'm going to be sending you something on hematology.
And we only treat the primary?
Yes.
We don't treat secondary, correct?
Yeah, remember, anytime the kidneys detect low oxygen, they're going to release a hormone.
Smokers,
Erythropoietin.
Yeah, erythropoietin. And so if you move to Denver, where there's less oxygen, you're going to have more red blood cells than down here in sunny California. Okay, but that's normal. That's an expectation you can have. So we're not going to treat your increase in red blood cells. But if you have polycythemia, it means that the bone marrow is making too many, so we're going to kill it.
Those red cell masses, do they do it on a lot of smokers because they don't know whether or not it's secondary?
Honestly, I have a feeling that after this meeting of ASRT, you won't even see hematology anymore.
What's the purpose of treating primary polycythemia? What problems are associated with this?
Well, the blood gets really thick, and it starts embolizing organs. Literally, it's like mud. It's trying to push mud through. So you have like embolization of organs, heart failure. So normally, what they do is they call venous section. They take out like a couple of pints of blood. They spit it down. Yeah, bloodletting. Well, they throw out the red cells, but they put the plasma back into the patient. They have to do that a couple of times a week.
So people who have secondary polycythemia, they also have increased chances of heart attack and all that stuff.
Well, it's not as thick as it would be if it was primary.
Oh, I see.
So, yeah, in fact, the Olympic athletes, remember I told you they train up there at Denver specifically for that reason? One of the big things that athletes used to do was blood doping. A couple of weeks before an event, they donate blood, and then just prior to the Olympics, they have that blood reinfused. So, and that's another test that we can do to see if somebody's been blood doping. Okay? I don't think they can do that. You can do a hematocrit.
Dedicated.
No, they do it. If you have extra oxygen, wow, you're good. Like when they had the Olympics in Mexico City,
I'm sure they're all at something.
the altitude and everything. Okay, then the next, according to the NRC, written directly for I-1 or 50 milligrams of iodine must include the following. Okay, and basically just the prescribed dose. That's it. We don't, the lot, they don't normally put the lot number of radiopharmaceutical down. But the written directive will definitely say 15 millicuries.
The written directive is another word for order. That's-
Yeah, but it's more than just
More than that?
specific order. It's a lot more detail to it. It's, okay, the NRC written directive for the administration setting strontium chloride must include, okay. Now, same thing up here, prescribed dose, the route of administration, so it has to be given intravenously. And the signature of an authorized user, where would you find that at? Well, let's say, Dr. Smith.
Oh, on title 18, 12.
2010, 2010 B,
Now,
It's on the title, right?
Mr. Singh, where would you find the signature of the authorized user?
Yeah,
That's what it's called.
The doctor's office?
No. Ashley, where would you find your authorized user signature?
Order?
No. Okay, this is your radioactive material license. Remember, your radioactive material license lists everybody who in the department is allowed to use, prescribe, interpret nuclear medicine procedures. Okay? And if that name isn't on there, then they cannot do the stuff. If your name on the list, you've got to quit. You got to quit.
Doctors who inject lymphs.
Anybody that handles radioactive material has to be on your license. And if they're not, then you better get an amendment. Okay, really fast. Okay? I like this question down here. It says, according to the NRC regulations, whole body dose limit for adults is?
That's
Occupancy.
5 rem.
5,000 milligrams.
That's 5 rem is equal to 5,000 rem. Which is tricky.
Yeah, so that is 5 rem, so.
Oh, yeah. So,
But like I said, you have somebody who's in a really playful mood.
It's put 5 in, right?
Yeah. Should be 5, that's 5 rem. But remember, a normal allowable dose for you as a technologist is 100 mR per week, 100 milligram per week, because they anticipate you working 50 weeks and having 2 weeks off, either through a combination of holidays or vacation or whatever. The other thing is, I hate to say this, you need to remember your doses in both millirem and sieverts, millisieverts.
It's 100, a factor of 100.
It's a factor of 100, but like here, according to, we know that it's 15 rem to the eye. Okay, so 15 rem times 100, so 150 millisieverts. Because remember, a millisievert is how much of a difference is it?
I don't know.
Was it 1 5?
1 rem is 100 sieverts.
Yeah. I'm sorry, 1 sievert is 100 rem. No rem. I mean, it's 100 rem.
100 rads and 1 gray, right? Okay.
100 grams is 1 sievert.
Yeah. 100 rem is 1 sievert. 100 rads is 1 gray. So normally, if you use the unit centigrade, okay, centigrade means the same thing as a rad or a rem. So it's 100th of the dose. So this is a millisievert, which is 1,000th of the dose. So it's another factor of 3.
100 rem per sievert.
Yeah.
Well, if you
You
go
guys want to
by
take a short break?
you go by alphabetical, the S into the R, so 1.
Okay, why don't you take about a 10-minute break?
And 1 gray to 100 red. The
I
G will be
remember,
for R.
I know there was 100 rads and a gray, that's how I remember it. So
Yeah.
if you take 100 rem to that side.